Good morning, everyone. Welcome to what is becoming our weekly Town Hall Facebook session. Glad you could all be with us. Hopefully we'll be able to increase the numbers of people that are tuning in. I know there's a lot of questions that everybody has. We had one of these last week and answered a lot of questions, but I know there's a lot of conflicting guidance out there. So I'm with a friend of mine and fellow Wing Commander Gary Charlton from the 107th today. We're actually in his building. We decided to come over and see how the other half lives, and I want you to know that he and I are in lockstep in the things that go on the base. We've got a great relationship and mutual supportive relationship, and every day we meet at least daily to talk about the things that are going on here. So I appreciate all you're doing.
Yep, thank you.
Some unique mission sets there, and we want to make sure that we take care of your folks in what we do. The big news today, you may have seen yesterday that the DOD required all military installations to go to HBCon Charlie. So we followed suit according to that dictate, and we've gone to Health Protection Condition Charlie. Really didn't change a lot of what we were doing. We'd already kind of implemented some measures that kind of put us in that condition anyway. It might restrict a little bit more some access to the base, and we may curtail a few people that may not need to be here, but we've been doing those things pretty much already. You've probably seen that we're encouraging maximum use of telework and telecommute. We've also restricted and cut down some of our access to facilities. The gym is closed. The VX has restricted hours. We've restricted access to the base to those people who need to be here and contractors who need to be here. The CAC, where we normally have meal service, is takeout, curbside only. And we've kind of consolidated our lodging facilities just to those people who have a military need to be on the base. So those are some of the things that we're doing right now, and obviously we're trying to make sure that we keep a healthy force, that we take care of our people, and we are extremely concerned about our family members, particularly those whose families are deployed. So that's our main focus right now, is caring for our airmen and their families, and we've talked a lot about that. Recently, in the last week or so, we've identified someone for the installation who is our public health emergency officer, Major Marte, who's a flight surgeon, and also been trained in disease pathology. He's somebody who counsels myself and all commanders on the installation. He's in our nightly meetings that we have with all the senior leadership on base to advise us on how to deal with what's going on. He's connected with the CDC and the Department of Public Health, so he keeps us abreast of that, and he's advising us on that. We have not declared a health emergency on the base. There was nothing that was really driving us to Charlie other than the mandate from the DOD. So we have not had any confirmed cases on the base at this point. We're still kind of looking to that to be kind of a trigger for us as we go forward. I took a couple of notes on some of the things that I know people have expressed some concerns about. Recently, in the 9/14th, we sent out an ad hoc message to all of our members asking them to call and report anyone who had been tested positively for COVID-19 or anybody who had been directed to self-isolate or quarantine as a result of contact with someone. We also are asking people to let us know if they're self-isolating because they have had exposure to someone that they feel is a threat. Those are things we're doing internally to just keep track of our people, mainly for two reasons. One, we want to make sure that we're bringing people who have been screened onto base when we need them to work. And two, and probably even more importantly, we're concerned about making sure that we take care of family members and we provide opportunities for them to still work and have employment if they find themselves needing to be isolated. Operations are still going on at the base. If you come out here on any given day, the 107th is still engaged in their primary mission, and they will be. You see airplanes flying around the local area. We're still engaged in critical operations that we need to do to keep our mission sets going. And we're still flying. People are still joining the military. I swore 2 people in this week. So like we said, if you're interested in serving your country, sometimes these things bring out people who really want to make a difference. People are still joining the military. And the base is still open for the most part. Actions are going on, activities are going on the base as normal. There's some concern now, and I'm particularly concerned about those who are worried about their deployed members. That's a lot of questions both units are getting. What are we doing? We've heard the stop movement order, the 60-day stop movement. I would tell you that is something that is my number one concern right now is to be able to communicate to families what they can expect from people who are deployed and expected to come home, but it's a changing target every day. I would say this right now, I know that our staff has a 1300 meeting today to try and clarify that, but basically it's a changing thing, and right now everybody has stopped for the most part, and we're looking at what that is going forward. So not a lot of clarity on that today, but again, we're going to continue to hold these meetings. We're going to continue to push out information as we get it. If you have specific questions about your member, I would encourage you to call your unit and talk to your commanders, because they're daily communicating with me and my LRS personnel on what the latest updates are there. And again, we're looking specifically in-house at every individual that we have deployed by name, by situation, and trying to address some of those concerns on a by name basis. And as we get more word, we'll get policies out to the family. These Facebook Live sessions will continue, at least for us, and I'm assuming Colonel Charlton is going to do the same thing so that we get the message out. Spread the word. Key Spouse are helping us to spread the word. We appreciate all they're doing, but get the word out to people who may want to tune in and ask questions. And as always, if for some reason we don't get to all of your questions today, we're keeping track of those. We'll answer them, we'll post them, and these sessions will be also posted on our SharePoint and other sites so you can access them. So I want to turn some time over to my friend, Colonel Charlton. How things going in your world?
Great, thank you, Mark. Appreciate it. Appreciate the opportunity to be here with us today. So the 107th and the 914th, we're in lockstep with everything that we're doing. So it's pretty much a DoD-wide policy that we're implementing. So HPCon Charlie, we're going to comply with everything that's being pushed out by the 914th, and we're pretty much already there as well with the 107th. We're executing the social spacing, we're executing the max flexibility to telework as we are legally authorized to do, and I think people have seen that, and it's working quite well at this point to maintain that social distancing and to try to tamp down any type of spread of the COVID-19. So with those things going forward, there's a lot of uncertainty that we've talked about. The stop movement, we're going to be working with every individual as to the max extent possible. And individuals may be deemed differently.
Right.
Each individual may have a separate case, but right now we are going to go with the moving target of 60 days, and we're going to see where that plays out for our folks. Some of the other things that people are talking about, I know you brought it up in your previous town hall meeting, your April UTA, your April RSD. So for the 107th April RSD, which is in April 18th and 19th, as it stands right now, we have not canceled it, but we are looking at max options that are being applied and are being liberally given to us. So by next week, we will have guidance for your commanders. Please reach out to your commanders, and then guidance will be flowing out to the organization. So we'll know exactly what we're doing. Again, just like in Mark's situation with the 914th, our first and foremost concern is the health and safety and welfare of our unit members. After that, we all do have a mission to execute. So with that, we are still executing our 2 Title 10 missions with our folks in the 222nd and our folks over with the operations group flying the MQ-9 remotely piloted aircraft. So those 2 missions right now are 0-fail missions. So we're going to continue to fly, fight, and win today's wars. We're going to make sure we're supporting those operations. The people that need to support those operations, you've been identified. You know the job you need to do, and you know where you need to be to execute those, and we thank you for your dedication, your service to that. The other aspect of the Guard, and just like we're still recruiting, we did our first FaceTime enlistment the other day. Yep. So we're in uncharted territory, and we're looking to continue to explore those uncharted territories and make the most of them that we can. So yes, we're still recruiting. We're still looking to get more people in, and we're doing the best we can, and our PAO is pushing out the stories so that in conjunction with your PAO to ensure that the mass footprint is out there for us. So the next mission we have is obviously the Guard has a steady state Title 32 mission. So we are activated in a small aspect and small footprint, which is going to ramp up as we speak. It's ramping up to 150 personnel across the Army and the Air Guard this afternoon in the JTF-5, which is our region that we operate in. But as we speak, we have 20 personnel from the 107th down in New York City right now, ground zero, if you will, working and doing the great work with our airmen. 5 of them out of the medical group and another 15 out of the services, our FSS flight, or squadron, sorry. So,
yeah. And that's important for our folks to know. You know, we do our steady state missions, but for you guys in the Guard, the state is asking a lot. And I know that we've got other Guard partners on the base. The Army Guard's here with medical units. They're looking at them for possibly getting into and helping with people. We've got guard units that are exploring possibly helping out with Customs Border Protection. So, and all the other things you have to do, I know that's a big ask. So the base is open, and we may see people flow through here, and they are flowing through here to come in and process and then get out into the community, and we are supporting the community in a big way. I say we, meaning our total force, but we're here to support that. So as you hear about those things, where governors are using the guard, you can bet that it's affecting people that are here on this base and this installation. So let's go, anything that we want to talk about. One of the things that came up, a question we were talking about before, was with regard to telework and max telecommuting. So we're encouraging people to telework as much as they can. We're looking at trying to maybe flex some of the schedules for the connectivity issues that are associated with everybody trying to get on the internet right now. It's causing some problems there. So we're looking at those options, but some of the questions were, can I telework with my children at home while I'm providing care to them? Normally that's not authorized, but in this case, there has been an exception to policy for that from this point until December 30th. If you are having people that you're caring for in your home, you can still telework. One of the other questions I heard was, can I be forced to telework? Well, currently, we're not in a situation where we're forcing people to telework, but if it gets worse and we do enact some of our continuity of operations plans, there is a provision there that if it gets bad and we need to, we can direct people to telework. But right now, at least as far as the 9/14 goes, we've not done that. We're asking people to volunteer to do that and to do it as much as they can. And like I say, we've identified those people who need to be at the base. And when we talk about a mission critical force going forward to keep those critical missions going, we pretty much have already, if you're coming to the base, it's going to be a subset of that population, and the rest will be asked to telework. Other questions I get: what if I am not authorized to telework in my job? It's not I'm a crew chief on the flight line and I can't telework and I need to be home, or you're telling me not to come in. In those cases, I need you to contact your supervisor, and where it's applicable, we have ways to take care of that as well with leave sick or leave weather, LN, that we can do. So contact your supervisor. I get a lot of concerns that communication, we want to make sure we're communicating, but it's a two-way street. So if you don't understand something and you have questions, please reach back to us and let us know. Okay, we've got both of our public affairs officers here in the background fielding your questions, so we'll take them as they come in.
Yes, sir. Okay, so our first question comes from Master Sergeant Brown Griffin. So he says, Colonel Larson, question about BMT. We are still recruiting and pressing forward. Have you heard anything in regards to splitting BMT locations or any delays with ship dates?
So I have not heard anything about splitting locations. With regard to ship dates, they are looking at possibly delays as a result of inability to move, but we're screening. Everybody that comes in for BMT is being screened by our folks before they go there, and then when they get down there, they have a process in place to make sure that we isolate them until such time as they're able to go out in the full population. So right now we're still recruiting, we're still sending people. The only thing that would stop us from doing that is if they curtail operations down there, but right now they have not said anything about that.
Okay, the next question comes from the 914th Civilian Personnel Office. So, knowing we still have a mission to carry out, with the new term essential missions from the OSDPA, how does that change if you were deemed mission essential personnel previously?
Okay, so two different categories there. Mission essential personnel in the previous sense is still a valid term, but we're not using it in regard to these critical missions that we have decided to do. It could be, in the critical missions, it's a subset of mission essential personnel, because mission essential personnel assumes we're going to carry out pretty much a normal day-to-day ops, and mission critical says we are going to go down to the bare minimum we need in order to keep our people current qualified, to satisfy our receivers who depend upon us for their training, and to have a minimum capability for a specified period of time that we've determined. I will tell you that we recently published our continuity of operations plan, which is what we would do, and one of the things that's in it, and the scenario that we most looked at when we crafted that plan, was a pandemic. It's hard to think about what would stop military operations in New York. We're not in a hurricane. We don't necessarily get fires and tornadoes, so we geared it towards a pandemic. So just recently we published that, and we looked at what is the minimum number of people and continuity of operations we need to keep a certain number of mission sets going. And that's what we would do if we actually got down to the point where we really had to restrict operations at the base. I don't know how that flows in your area, but I'm assuming it's probably similar.
Very, very similar, very same. Again, thinking we have the continuity of the Title 10 and the Title 32 mission. So folks are going to be pulled left and right from that. They might be in a situation where today they're max telecommuting, and tomorrow I'm going to be calling them up, tapping them on the shoulder to step up for a Title 32 operation, which may require them to come back on the base and fill a role that they fill specifically to that.
Even in that continuity of operations plan, it looks at how we would scale down here on this base, but it also goes into what if we, for some reason, couldn't come to this base, or we couldn't operate out of this base. We've got plans in place to go to places where we could operate, got an identified number of minimum personnel who would go with that package, so that we could maintain basic mission needs for a specified period of time. So we've already kind of rehearsed this before, and we have plans for that. And we've been working on the what-if scenarios for weeks now, so.
Sir, here's a question from the 107th side. If a service member, if they need support or help, who can they go to? Who can they talk to? What kind of resources are available?
Excellent question. So we have our DPH, Sarah Warner, our chaplain, Jeff Bartz, and our chaplain affairs associate with him is Warren Jones. They're both actually on state active duty right now. So they're here, they're ready, and they're available. They will take your phone calls 24/7. You can always work through your first sergeant, you can always work through your chain of command, and you can always call us. We're always available to discuss anything at any time, day or night. So the services are there. We encourage you to reach out to them. There's a lot of unknown, there's a lot of uncertainty, there's a lot of anxiety out there right now about where's my next paycheck gonna come, what's the stimulus package gonna be doing that the Congress is working through today. We really need you to reach out to these people and talk through your issues and seek the help that you need so that we can get through this together. Because it is all about the members, and we are first and foremost concerned in making sure our members are taken care of going forward. And then we get you right back, and we need to be executing the missions.
And we still have our financial advisor. I think we can still reach out to him. There's a lot of financial turmoil. I know that's causing people to be concerned with what's going on. I mean, if you were at home watching things going on the news every day, I think you would probably go crazy.
Exactly.
But there's all those resources, as well as the key spouses. You know, we've got a great key spouse group, and they're there, particularly if you've got somebody deployed. Our key spouse, Betsy Russell, has direct contact with me for things that you might need. She can call me on my cell phone anytime, and we can communicate that way as well.
So, Sir Colonel Larson, next question. Is there any word on any dress and appearance standards regarding haircuts?
It's funny you should mention that, because about a week ago, I don't know what her name was, but in an AfriCat VTC, she said, "Sir, we need to probably start looking at relaxing the grooming standards because people aren't going to be able to get out." And I for one, I'm getting ready to get a haircut. I know you are. But I looked yesterday and I said, I can't get a haircut, so I'm going to end up trying to figure out how to keep within regs. But I think there's been no official policy on relaxing, but they're looking at it. And of course, right now we're not doing open ranks inspections anyway, so we'll deal with that as it comes up. But yeah, they have not officially published any guidance, but they have talked about it, which I thought was kind of interesting. Yeah, go ahead.
And to caveat that, this is also an opportunity for people to don't lose focus on not just the customs and courtesies and grooming standards, but don't lose focus on your own personal health and your own fitness standards.
Right.
The gyms are all closed, but there's nothing stopping you from getting out and going for a jog, going for a walk. The weather's getting much, much nicer out. There's still got to focus on our own health and well-being and our fitness.
So I've got a question here for both commanders. Are there any plans to get test kits for COVID-19 for 914th or 107th personnel?
That might be something you may be able to,
Well, so neither wing is an actual MTF. So we're not in a facility or a position where we can test those people. Obviously, we both have members of our organizations and our medical groups that are licensed physicians and do have those qualifications. I have no information regarding this that we're going to get those test kits. And if we did, we'd have to fall back under the CDC guidance, New York State Department of Health guidance, as to those who require a test to ensure that those that do need a test get the tests.
Yeah, so when he's talking about military treatment facilities, it'd be like on an active duty base where you have a hospital and the staff to do that. Our public health emergency officer, Major Marte, who is connected with the community, he's a physician out there. He also teaches at Buffalo University. He has constantly updating us on the availability of test kits in area in Niagara County, and there is a huge shortage, particularly in Niagara County right now. And they're prioritizing those people, I'm not gonna touch my face, those people who are needing to test, and I can tell you that any kits that come into this area are gonna go into the community, and we don't have the ability, as you said, to do them anyway.
And because of the shortage, those that need the test need basically a prescription from their primary care to go to one of those drive-through test sites and get a test.
All right, so we have time for 2 more questions. This next question here comes from Marty Vigato.
Hi, Marty.
Colonel Larson, 914th MXG training. Could you ask AFRIC about members attending tech schools? Some schools are quarantined and others are not. Example, Shepherd yes and Keesler not.
So this has been a big discussion item with regard to AETC and some of the AFSC training, particularly even Altus, where we send our pilots for follow-on flight training, had some different standards. So I can tell you that our command, I can't speak for the Guard, but our command has been very, very adamant about trying to standardize across the board in AETC for these schools on what is the process. Some have got quarantine when they get there. Do we put people on orders before they go there, or is the isolation there part of their class, or is it prior to the class? Is it after their class? So we're asking those questions, Marty, and I can tell you AFRIC, A3, and A4 are all over that right now, trying to get word and standardize those things.
So, sir, our last question here. We want to ask you, do you have any closing comments for our younger audience, our young airmen who are brand new to the Air Force, new to the service, or even younger families who might not be familiar with what's going on? Do you have any kind of message for them?
So I can tell you that from everybody that I've heard from, General Scobie, General Goldfein, all of our senior leadership, their number one priority is taking care of our airmen. The Air Force is a big family. We want to know where you are in your everything, from finances to mental health to physical health. And if you make those needs known, the good thing about being in this situation as part of the Air Force is that we have the means and the resources to actually do some things that maybe some of the local businesses and communities don't, and we're here for you. And I mean that sincerely. We recently had someone whose family member passed away, and it's someone that's close to me and in our unit, and my heart just goes out for them. And there's a lot of angst out there, and I think depending on what you do with your day and how much of that you want, you can go completely crazy. But it's time, kind of in flying, sometimes when the airplane's out of control, we just have to freeze the stick. You just got to stop it, recalculate, and go. Okay, the sun came up today. It's a beautiful day out there, and it'll come up tomorrow, and we'll get through this. And even though some predictions say this may go into the summer, we really don't know, but it's the next several weeks where we need to encourage people to do what you're asked to do. Don't go out and be in the community. There's a reason why we're quarantining, and it's to get us to slow the progress so that our medical professionals can keep up with what's going to be an increasing number of cases. I suspect when they start to test in Niagara, we're going to see our numbers go up. That doesn't mean it just all of a sudden everybody got affected. It's just our ability to do that. So stay calm, hold the stick steady, let us know if you're having problems. We will work with you. I particularly want you who have deployers out there to know that by name today, I sat down with my folks and said, by name, tell me who this person is, where they are, what their situation is, and daily I'm going to get them to update me so that I know where your folks are and I can give you the most current information.
I echo everything that you just said, Mark. Definitely there's going to be a lot of stress, there's a lot of anxiety, there's a lot of unknown. Talk to your supervisors, talk to your commanders. Please use the appropriate sources for information. We've pushed out the sources, use the CDC, use the New York State Health Department. Please use those sources for your information as we go forward. This is going to be the new norm. This is going to be the new flu season probably as we come out of this, and we're all going to come out of this better, stronger, healthier as an organization and as a family. And we are here for you. We're here for the families. We're just, if you got to reach out to us, you got to talk to us, you got to use the resources that we have available for you, and we're all going to get through this together.
So, sirs, I know we said this is the last question, but we had one more pop in if you have time for it. We have a question from Ms. McCohen. Just got here, not sure if this has been asked or not. Why can there not be quarantine for returning deployers and deployers being sent instead of a freeze completely?
So the problem with bringing people home is travel by the normal carriers that we get people to and from the AOR, if you will. It's not so much being able, we have plans in place if they send people home to isolate them here, or to isolate them there, or isolate them wherever they touch down. It's getting people over there and picking them up and bringing them back. So there's all kinds of options they're looking at. They still are running a few of those, but again, they're taking everybody case by case. But it's again, trying to stop until we see how this levels out before we affect those people who are over in the AOR, and we decrease our capability. But those things are being talked about. It's a great thought, and I can tell you they're looking at that because particularly in the Guard and the Reserve, for the volunteer citizen airmen, they've got jobs they've got to do. They've got to be able to get back home to have some normalcy in their lives. So these things are being talked about. That specific thing is being talked about. Why can't we even maybe possibly bring them straight home on a military aircraft and send them here and do it? All those things are being done, and that's why I say the stop movement is there. It's been highlighted, but they're trying to figure out how do we get around some of those things with those people that need to get home.
Sir, so a quick follow-up, a couple questions on the April drill. Again, if you want to
Sure.
reiterate that, sir.
Anything specific? Or-
They're just asking if drill is still on and.
Okay. As we sit here today, because drill's not until April 18th and 19th, yes, drill is still on. What drill looks like, that's we're working through right now. Whether we do split drills, whether we do reduced drills, whether we expand the telework options that are available to us now in the expanded guidance from NGB A1 for how we handle DSG in the telework community. Those are all being explored. First and foremost, again, we want to make sure we're taking care of the people, and we want to look at the second, third, 10th layer of effects as we go forward. Some people might really be relying on that paycheck, on that drill weekend, and we want to make sure we're really reaching out and addressing each individual's needs as we go forward. We also have to be thinking about our readiness. We still have to maintain our level of readiness. We still have to maintain our support to the 2 Title 10 missions that we're operating and the state active duty. We're also, just like the 9/14th, we're also looking at making sure that people have a good year, they have the points, and that we're not further incurring hardships on someone by arbitrarily rescheduling the drill in 3-4 months from now. So we're looking at all kinds of options, and there's lots on the table right now that we're going to be working through. So stay tuned and be in touch with your commanders in another week or so, and we'll have some more solidified guidance for you as to how we're going to approach this.
And you bring up a very good point for us, I hope I can go just a little bit longer. With regard to people who are worried about a good year, there is some discussion about trying to legislate that problem away, but absent that, we have identified those people who are at risk by moving some of these training periods and not allowing people to come in and do duty. We've already identified who those people are in the 9/14th, and the commanders know who they are. They will be reaching out and trying to provide opportunities to telework, telecommute where we can. There's training that can be done online. There's other administrative things that we need to do. All those things we can look at to try and help people make sure they get a good year for both paying points good year, and also those people who are affected, their bonuses may be affected by not participating. So we looked at this, started a week, 10 days ago, and we've already identified those people, and we're reaching out to their commanders, and they should be reaching out to you.
So, sirs, that brings us to the end of our time. I just want to point out to all of our viewers at home to continue to monitor niagara.afrc.af.mil and the 107th Attack Wing website as well. There are a few more questions that we have here. Please keep posting them. My team will be going back and answering those as best as we can. So we'll still keep engaging with you, but we're going to have to wrap up here. And so, sirs, if you have any...
One more thing, if you don't know, there is an AFRIC Facebook live session tomorrow with Chief Wright. I think it's at 2.
Yes, sir, 2 o'clock.
2 o'clock on the AFRIC webpage. If you want to hear from my boss's boss, if you want to get some questions there may be some things that come out. There may be some more updates on what we talked about today with regard to the deployers. But Chief White, the AFRIC Command Chief, will be hosting that. I know General Scobie will be on the line, but he's also teleworking and where he can at times. So all of us are trying to stay safe and healthy so we keep things going. That's why we're so far apart.
That's right, that's right. And from the 107th, your leadership team can't thank you enough for everything that you all are doing for us and supporting us. These are difficult times for everyone, and there's a lot of stress and anxiety, as I've said. But there's a lot of work that still needs, a lot of good work that's still being done. So, thank you, and we'll see you around the flagpole.
Wash your hands.